Hello, everyone. Welcome and thank you for joining us for our discussion today on the South Sudanese Women Intellectuals Forum. My name is Dr. Anne Lomole, and I'm a pediatrician and an infectious disease consultant. And I will be the moderator for this session, and I'll be introducing our panelists today. Today, we will be discussing women health issues. We'll initially focus on cervical cancer due to previous requests to discuss the topic further. When it comes to women's health, we know that delay in healthcare seeking is quite common due to a number of reasons that can be specific to women in terms of lack of empowerment, lack of knowledge, and financial resources. And in a country like South Sudan, whose healthcare system is worse off than the rest of the region, the lack of well-equipped facilities and human resources, it becomes difficult to access healthcare and for early interventions to be initiated to prevent loss of life or progression of illness. Now, there's a need for our country to improve its healthcare services in order to offer treatment and to develop and train specialized human resources. And there's also a need for health education of the public to ensure that people are able to seek healthcare when it's needed and before it's too late. For this discussion, we are joined by Dr. Kiden Annette, who is an obstetrics and gynecology resident currently based in Nairobi, Kenya. I'll just read a short bio in a few minutes. We hope that this discussion today will be able to educate the public on women's health concerns and discuss some of the challenges and barriers to accessing healthcare and possible solutions. Now, we would like to request the audience to send in their questions. We will try and broaden the topic a bit today. Please send in your questions, specifically directed towards obstetrics and gynecology health issues, because that is what Dr. Kiden is specialized in. And feel free to post the questions on our Facebook wall. We are currently streaming live on Facebook and on YouTube. And we would also like to thank the audience for joining us today. And we would like to thank all our supporters and the donors who have brought us to this day. We'll go straight to the discussion, but I'll start by introducing Dr. Kiden. Dr. Kiden Annette is an obstetrics and gynecology resident currently at the University of Nairobi in Kenya. She's doing her Master's of Medicine in Obstetrics and Gynecology. She works at the Kenyatta National Hospital, which is a referral hospital in Nairobi, and she has an undergraduate degree in medicine and surgery from the Kampala International University. She's very, very passionate about women's health. For those of you who don't know her, she's been one of our panelists quite a number of times, and we can all feel her passion when she answers some of the questions that we pose to her. So welcome, Dr. Kiden, and thank you for joining us again. We are so grateful to have you here and grateful that you took the time to be with us on the South Sudanese Women Intellectuals Forum.
Thank you very much, Anne, for welcoming me, and I'm happy to be here.
Thank you so much, Dr. Kiden. So we'll go straight to the topic of discussion today. We decided we want to talk about cervical cancer again because quite a number of people felt like they needed a bit more of an expounding on the topic. But we're also encouraging the audience to send in other questions related to women's health when it comes to obstetrics and gynecology issues. So I'd like you to begin by, setting the stage and just telling us, what is cervical cancer? When doctors say this is cervical cancer, what do they mean exactly?
All right, thank you very much for that question. I will explain it in this way, that cancer in general is an abnormality in the multiplication of cells in any tissue of the body if they undergo uncontrolled multiplication. Uncontrolled in a sense that the control mechanisms that the body has to make sure that the cells multiply in a proper way is lost. So these abnormal cells continue to multiply. It can even develop from one cell, and then it goes multiplying uncontrollably. And then at the end of the day, they can invade the surrounding structures. They can also go to other parts of the body. So cancer of the cervix or cervical cancer is an abnormal growth of the cervical cells in a malignant way. They grow autonomously, And at the end of the day, as I have said, they invade the surrounding structures, and they can also be transported to other parts of the body through blood or the lymphatic system. So when that happens, these cancerous cells will begin to compete for nutrients, they will compete for oxygen, and cause dysfunction wherever they are found. So in the cervical cancer in particular, they can invade the structures around there. There's so many important vital structures like the ureters, the bladder, the rectum, and the vagina. So all those, they will begin to not to function well. So that, in brief, that is what I could explain what cervical cancer is.
So basically, it's like the body loses the control in terms of the multiplication of cells, and therefore
Yes.
these abnormal cells multiply and then invade normal tissue around it. That's basically the simplest way to
To
define
put it.
cancer. And when we say
Yes.
cervical, then it means that is the location of this particular type of cancer. Thank you so
Yes.
much, Dr. Kidin, for that. Now, when it
Mhm.
comes to the epidemiology of cervical cancer, what are the statistics? Are there any available on South Sudan? What are the statistics when it comes to Africa? And how does it compare to the rest of the world? And if it's different, why the difference?
Well, it is unfortunate that South Sudan in particular, we don't have data on the epidemiology of cervical cancer. But it has been recognized as one of the causes of maternal or mortality among among the females. So we really do not have data. I've tried to look for it, and it looks like it's not there. So, but when it comes to Africa, we have some data that we have. Apparently, it is estimated that around 80,000 new cases per year are diagnosed in Africa and the low-income countries and middle-income countries. And out of these 80,000, 60,000 of them, they die every year. So the situation is really not good at all. And globally, what is there? Usually, they have reported, WHO has reported 570,000 to 604,000 new cases per year. And out of this, ranging between 311,000 to 342,000 deaths, and 80% of these occur in the middle and low income countries, where our South Sudan is included. And so the difference is that for South Sudan, actually, out of this data, we don't have a contribution. So our numbers are not captured because we have not provided it. We have actually nothing to compare with, right? Yeah. So that is how I could respond to that.
Okay.
Thank you.
Thank you so much for that, Dr. Kidin. In terms of some of the risk factors and the causative factors of cervical cancer, why do you think
Mhm.
that the low and middle income countries seem to be featuring so highly on the list in terms of the deaths? What do you think the reason might be?
Well, some of the reasons why we have high prevalence of CA cervix prevailing in our midst, it could be simply because we have poor access to medical facilities. The women do not really have access there. And if they have the access, most of the time, we do not have the mechanisms through which we can prevent it or treat it. We don't have the ability to even screen, for that matter. And then the other thing is that we may have some comorbidities. For example, the HIV pandemic is very high in Africa. So, and if you're HIV positive, your chances of getting cervical cancer is multiplied 6 times. So the comorbidities are a major contribution in Africa. Things like anemias, things like malaria, ill health, you see, immunosuppression for that matter. So at the end of the day, we have very high numbers because we are vulnerable to this cervical cancer. Yeah.
Okay.
And then the other thing
So
is probably it could be late presentation. Late presentation. We have very poor seeking habits in Africa in general. We rarely do not want to talk about our reproductive health issues. If I have a discharge, it's difficult for me to come even to the doctor and tell him that, you know what, I have a discharge coming from down there. I am bleeding. I'm having this difficulty in intercourse and all that kind of thing. I cannot express it. It is something that is in us. I think we need to drive it out.
so basically there's a lot of shame and taboo associated with the reproductive health system and discussing issues related to diseases or illness that affect the reproductive health system, and that is something that needs to be looked into in terms of health education and creating awareness. What are some of the risk factors or causative factors for cervical cancer that you've come across?
Thank you very much for that question. And I think this is where we're going to really lay a lot of emphasis. One most important risk factor for cervical cancer is what we call infection by human papillomavirus, HPV. Now, infection by HPV virus is contributing to over 95% of the cervical cancer cases worldwide. So it is number one important risk factor that every one of us should take note of. Infection by HPV virus. The other risk factors then, maybe before I go ahead, I need to point out that HPV virus is transmitted sexually. Okay, so the other risky factors then can follow could be one, having multiple sexual partners, early sexual debut, or having a partner who has got other multiple sexual partners. Okay. Then, as I had mentioned earlier on, immunosuppression is one of the comorbidities. The other important thing is smoking, cigarette smoking. Those are some of the things that we have found out to be responsible or risk factors for cervical cancer. Okay. And many more.
Thank you, Dr. Kidena, and thank you for even emphasizing on the sexual transmission of the HPV virus. I think later on we'll talk about prevention, and that will feature quite a lot. The viruses have been known to really predispose to cancers quite a lot because they mess up the mechanisms of control of self growth. So the fact that the HPV virus was associated with cervical cancer was, I think, sort of like a breakthrough in terms of determining causation, and therefore then that opened a door for prevention to come in. So we'll go ahead and maybe talk a little bit about that. So how are health professionals currently able to address cervical cancer prevention, and what are the current prevention strategies? And maybe just tell us a little bit about the HPV vaccine, who gets it, when, and how does it help?
Okay, thank you very much. It is great actually to discover that CS cervix is caused by HPV virus. And the good news is that the HPV infection, as we have said, that is sexually transmitted. So it is acquired during the reproductive age, during the age when people are sexually active. So, and then another important thing is that this cervical cancer, by the time it is developing, it is 10 to 20 years from the time of infection. So, with this long duration of time, we can actually catch it early, and that is very, very important for us to take note of. It does not make you to feel laxed that we have plenty of time, so we can waste time. No. The good news is that the advantage it gives to us is that we can catch it before it causes harm. Okay. So the health workers, what are we doing to make sure that we prevent this cervical cancer? We have got stages, and we have grouped it into primary prevention, secondary prevention, and tertiary prevention. In primary prevention, we have the vaccines that we vaccinate women against the HPV virus. Vaccination is simply making you immune, such that by the time you are exposed to the causative agent or the HPV virus in question, when your body is immune from its effects, it doesn't take. So your body is immunized. It is like any other immunization programs that we have. It protects your body from acquiring the infection. Okay, so that is that. And then under the primary infection, of course, we will go ahead and educate you on the safe sexual behaviors. Okay, ensure that you have one sexual partner, and if you think that you need to have more, then you need to use condoms and other mechanisms of protecting yourself against it. And then, of course, those ones that are smoking, we just stop to do it. That is a primary prevention. We are preventing the virus from getting into your body. Okay, so then we have the secondary prevention where we bring in the screening. Now, before I go to the secondary prevention, in the primary, how do we go about the vaccination? Um, Girls from 9 to 14 years are vaccinated, and we get a maximum of 2 doses. When you vaccinate your girl from today, that is day 0, and then you will have to wait for 6 to 12 months and give her the last dose. And that should happen between 9 and before the 15th birthday for the girl child. So in case you have not vaccinated the girl at that level, then you'll have to do from 15 years onwards, perhaps up to 30 years, you can still vaccinate, but then they will have to get 3 doses from 0, 1 to 2 months, and then to 6 months. Those are 3 maximum. Next is the secondary prevention. In this way, we do screening. Okay, why do we screen? We screen to make sure that we get the precancerous lesions. Good enough, the HPV virus, when you get infected with it, I have told you that it takes 10 to 20 years. Those are 2 decades in such that you can develop now the active cancer. But along the way, we can be able to detect how far the development of that cancer has reached. So we screen such that we can catch it in that early stage, in the precancerous stage, or if it has become actual cancer, we can detect it as early as possible before advanced stages. So that is the secondary prevention. Then the tertiary prevention is when, after now you have been diagnosed of the cancer, then we can treat immediately, immediate treatment. And then finally, if there is nothing else that we can do, then we can do palliative care. Yes. Is that okay?
Thank you for breaking. Yes, thank you for breaking it down to those three prevention: the primary, the secondary, and the tertiary. And it's important to note that our behavior in terms of sexual behavior contributes a lot to whether we're exposed to this virus or not, and therefore one has to take into account in terms of how many partners they have and how they're protecting themselves when it comes to sexuality and all that. So thank you so much for breaking that down for us, Dr. Kidin. Now, you had talked a little bit about screening as one of the secondary prevention strategies. How is this done for someone who's never had any screening for cervical cancer? How is this done?
Well, that is great. We have different modalities of how we screen for CS cervix or for the precancerous lesions. We have got one. We have what we call the Pap Smear, where we take a sample of the cervical cells and we look at them under the microscope, and then we interpret. In the lab, the lab technicians will give us a result, and they tell us either you are in first stage, second, third of the precancerous lesions. And then thereafter, if we have what we call low risk, or the infection has not advanced, then we have got those ones that have advanced from cyan 2, 3. And then thereafter, after we have done that and if the screening is positive, then we can go ahead and do biopsy and confirm what it is, or we can just treat you there and then. Okay. The other modality is the testing of the actual HPV infection, and we do that by looking for the DNA of the high-risk oncogenic types of this HPV. So we have those ones that we have got the HPV number 16, 18, 31, 33, and the others, there are many. Okay, they are oncogenic. So when we wanted to screen, we can look for that DNA that is particularly for the high-risk types of HPV virus. Then for the general population where you are not immunosuppressed, you can do that 3 to 5 years, every 3 to 5 years. That is okay. But if you're HIV positive, because I had told you that your risk of acquiring cervical cancer is increased 6 times. So we do that annually such that we can catch this virus as early as possible. And then the other thing is that when you are HIV infected or you're immunosuppressed, the tendency for you to progress very rapidly from the precancerous lesions to overt cancer is also increased. So we do it annually for those who are immunosuppressed or HIV infected. Okay, then we have the Via Vili, where we inspect the cervix under some acetic acid or Lugos iodine, and this is actually very affordable, right? So we can do that very well. The other thing is for those that may have the resources from the HPV infection, we can also get actually to the molecular level, where we are looking at the messenger RNA to look particularly for the infection that has got the ability to cause transformation at the cervical level. So we can have all those. Depending on the resources that you have, then that is what you're going to employ. But at the end of the day, we are able to pick these precancerous lesions very early. Right.
So apart from the Pap smear and the biopsy, are there other ways to diagnose cervical cancer? And what are the signs and symptoms that we should be looking out for that would direct us towards this could be cancer of the cervix?
Now, thank you very much for that question. Cervical cancer is not diagnosed by the screening methods. Screening is simply to tell us that there is something suspicious here. There is a transformation that has occurred. So when we have these lesions, what do? We will subject the woman under what we call colposcopy, where we view and examine the cervix very closely for signs of, of cancer. Then thereafter, that is not enough. We will take sample or we do biopsy and we take it for histology or for tissue analysis, such that they are the ones to make for you the diagnosis. Otherwise, even when you come with the symptoms and signs of cervical cancer, as a health worker, I don't have the audacity to condemn you or to tell you that you have cervical cancer and you go diagnosing people on the streets. No, you must have a histological diagnosis. Why? Because there are some other conditions that can present with the signs and symptoms that are similar to cervical cancer. So when you tell somebody that you have cervical cancer without a histological diagnosis, then you will have created a lot of chaos, and yet the patient would have a simple infection, bacterial infection, or something like TB pelvis that can very much present in a similar way. So we must have histological diagnosis. So now, what are the signs and the symptoms for cervical cancer? Very important for us to know this, because when we are out there in the villages and in the rural areas, we should be on the lookout. So what are they? The mothers or the patients will come, or you will begin to experience what is the most common? The most common could be, depending anyway on individuals, but abnormal vaginal discharge. That progresses like that and it becomes foul smelling. It doesn't go away with the local treatments with the antibiotics that you get from the hospital you are treated, but the thing doesn't go. Then foul smelling. Secondly, you may have what we call the contact bleeding. Contact bleeding means what? It means that during intercourse, after intercourse, you may bleed each time it happens like that. You can also have intermenstrual bleeding or spotting. It continues to be like that. And then the other thing is that you can also have limb swelling, the lower limbs, the legs. It can be one and it can be both. They will swell. Severe abdominal pain that is not resolving, whatever the case might be. So those are some of the things that you may have to be on the lookout for. All right. Yeah, and many others that can present.
So basically,
And,
continue, Dr. Akidin. Yes, go ahead.
all right. I was saying that some of these things will depend also on how far the cancer may have progressed, and they begin to present with maybe passage of bloody urine. Yeah, if the cancer has invaded into the bladder. The limb swelling could be that it is obstructing the lymphatic vessels or even the blood vessels, so blood cannot easily travel up there. So that could be it. Yes.
So most of the signs are basically quite non-specific, and once someone has such symptoms, they should just seek medical care, and then everything else can be done, and the histological diagnosis can be made when we're able to get some tissue to look at. So, what are some of the treatment strategies for cervical cancer, and what is the prognosis?
Well, thank you. How do we treat cervical cancer? First of all, from the time of the screening, we can be able to pick an invasive cancer, invasive in a way that it has already become actually cancerous after from your tissue diagnosis. So we can have surgery that can be done. For the precancerous lesions, we have different modalities. We can have excisions, the lesion or the mass that is there can just be cut off, and and that can be curative. It could be ablation, where we just burn that particular part of the tissue, and then probably some people can have a hysterectomy according to how they feel. If they think that they are finished with their family size, then hysterectomy can be done. But cervical cancer itself, the treatment modalities is dependent on the stage of the cancer. If we catch it very early after we have screened, and we catch it in very early stages, that is up to stage 2A, we can do hysterectomy, and we remove the cervix together with the uterus. We all get it out, okay? And that can be curative because you will have removed the cancerous tissue at that level. That simply means that that cancer has not spread, it has not metastasized, it has not invaded the surrounding tissues, and that can be curative. So, what if we get the cervical cancer when it has invaded, it has gone beyond 2A? What happens? We have got modalities like the radiotherapy that we employ, and then also chemotherapy can be given, and there is a cure. Okay, but although the tendency also to recur or to resist the treatment is there, so our best way to do is to do what? Is to do the screening early, such that we can catch it early, and that can be curative. Lastly, if we catch it when already the things have gone bad, like the way we see in our teaching hospital here, what do? We do palliation. We treat the symptoms that you come with. If you're anemic, we give you blood. If you're bleeding, we can give you chemotherapy such that at least it can take away the bleeding. If there is anything that we can help you with, if there is an obstructive uropathy where your kidneys cannot work because the ureters have been blocked because of this tumor, we give you, we divert the urine to make sure that at least we can sustain your life small. So that is palliative, basically treating the immediate things that can cause death, okay, and to relieve symptoms. So those are some of the modalities that we have. But importantly, note this, that when we get the cancer very early, it is always curative, and we can continue to enjoy life like any other day. Yeah.
I think that's a very encouraging statement in terms of catching it early and it being curative. And I think that emphasizes the point that women generally should actually go for screening so that we're able to catch it early, and then it doesn't progress to the point of where you need now palliative care because none of the treatment strategies can work. Are there any if diagnosed with cervical cancer, are there any danger signs to watch out for, and why? Any danger signs?
If you are diagnosed with cervical cancer, the danger signs, what could be? I think that the bleeding should be something that you should really watch out for very, very carefully, and make sure that you are at least near the health center that you can be helped. The other thing is things like, as I have told you, that there could be a kidney failure, and so at the end of the day you could have yellowing of the eyes, or the liver failure, yellowing of the eyes, body swelling, and all those things. So you have to make sure that you take note of that. Yes.
Thank you, Dr. Kidin. Now let's flip it a bit and talk more about like the cultural, social aspects when it comes to cancer and cervical cancer diagnosis and all that. What are some of the
Mhm.
cultural practices that maybe prevent cultural or social practices or myths that prevent seeking of care? And what are some of the barriers to seeking care when it comes to cervical cancer or reproductive health cancers in general? How can we overcome some of these barriers?
Mhm. Cultural practices vary across communities, and the barriers do also happen at different levels, at different communities also as well. But in general, some of the barriers that we have got the political barriers where there is a lack of priority for women's health and the reproductive health. Generally, there is no political will to make sure that women's health is taken into consideration when there is planning. Do we look at how these women can be helped with with their diseases, or their sexual health can be taken into accountability, like the way we could do consider malaria and any other thing else? Is there a program that is in place that will ensure that these women do have do have a look into, as in the women, are they being cared for? And then the other thing is that we may not have, at a political level, things like national policies, right? National policies that give us guidelines on how to go about with the screening, to go about with the, the immunizations and the treatment of these cancers if we have diagnosed them. Are there guidelines that we have? And remember that when we were beginning, I had mentioned that we do not have data on this, and therefore that means that even the politicians may not have the basis for making these policies, because policies should be made on evidence based. So we don't have guidelines per se at the community level, or as a nation, or as South Sudan. We don't have our own policies that are dependent on the local data that we have. Okay. Then the other barrier would be the community and also individual barriers. Okay, there is a lack of an awareness. We don't know that cervical cancer can be prevented and it can be treated. So if we do not know, therefore, it means that we will do nothing about it. Okay. And then the other thing is that we can have misconceptions, uh, whereby if somebody says that I have a discharge is a taboo, how do you say it? Eh? What about if I have a discharge and smelling, foul smelling? I cannot come even for the burial of the other neighbor. I cannot come to the social place. I cannot go to the market because everybody is going to feel my smell, and I will keep quiet. I will be in my house. I will not do anything about it. I will not go to the hospital. And if it happens that I go there, I even don't tell the doctor that exactly my problem is not elsewhere. The problem is that I'm having a vaginal discharge, and that can be a big problem. The other thing is that the economics, finances, money is not there. People are poor, and more especially in the rural areas where actually 70% of these cervical cancer cases are fetched from. They don't have the money, and even when they don't have them, even when they have some money, where is the health facility to go to? And if they go there, are the health workers, are they proactive? to make sure that they can diagnose this, or they can check, at least they can examine these women for signs and symptoms of cervical cancer, or they just do something else. I mean, the health personnel may not be there. Okay, remember in the villages, these health facilities could be run by locals, and so they may not really know what to do when these women come. The other thing is that we may have organizational failures where we have poorly organized health systems. For example, if we can screen the cervical cancer, yes, down there at that level, and we find that the screening is positive, what do you do with such a woman? Do you have a place where you're going to send this woman? Do you have a place where she's going to receive appropriate treatment? So you see, all these things, and they are barriers to the control and the prevention of cervical cancers. And no wonder we have very high numbers in Africa. And basically that is that. But otherwise, the taboos and the misconceptions and everything like that, they vary according to communities. Okay, and so importantly, what we have to do maybe is that we have to go down there and do health education and inform them, particularly that cervical cancer can be prevented. Okay, yeah.
I love that message. Cervical cancer can be prevented. And I think I want to emphasize your point on the statistics and the fact that everything that drives policy has to be evidence-based. And if we don't get statistics to support our claims that this is something that should be prioritized, then it becomes very difficult to even push the decision makers to prioritize reproductive health issues, cervical cancer, the things that actually generally have to do with women. So the only thing I can say is that for those of us who are on the ground currently, for working in South Sudan, we should look into actually collecting data for not only cervical cancer, but many of these illnesses that are not considered infectious diseases, in order to be able to push or drive the decision makers into prioritizing some of these health issues that have largely been ignored in favor of infectious diseases in general. Dr. Kiden, you talked a little bit about health workers and about policymakers. So what would be your recommendations to healthcare workers and to the Ministry of Health on this particular issue of gynecological cancers and cervical cancer, to be specific?
Very good. Thank you very much, Anne. I think we cannot overemphasize on this point that we need data. I think each time I come on this forum, I think I've really made a lot of emphasis that without data, how do you present our issues? Yeah? So let's be proactive. If these women come, here is a monster with us that we can truly prevent. Okay. It is heartening, or it is depressive, if I can put it like that, when you go to the wards and you find our mothers, women that could be free from cervical cancer, when they have come very late, or when the disease is diagnosed very late, they are battling with life. Health workers, I think, let me be an advocate for the women or the community in large, that women, a loss of a mother in a family is a major tragedy to that family. So if we can do something, okay, if we can do something, let's collect that data. Imagine it can save a life. Okay, let's collect that data. And when these women come to us, they have come for malaria. They may have come because of minor illnesses. But please, as we do that, can we ask, have you ever been screened for cervical cancer? They will be startled and say, what is that? we have never had. And there is an opportunity for you to educate the masses, for you to educate that mother and bring to her notice that there is something that can be done and prevent that death, prevent the agony of that family that it will go through if that mother comes down with cervical cancer, something that we can treat. Okay, so the health workers, one, please collect the data. Let us provide it. Let us give it to the policymakers. If they don't want to do anything about it, that is out of your hands, isn't it? You will have provided what is needful for them to make decisions. But if we don't provide that data, they have nothing to base their decisions on. Secondly, let's screen these mothers at whatever level, and then let's make the necessary referrals that is needed. Okay, so in general, gynecological cancers like the CA cervix, the CA vulva, all those ones can be caught early in their development. And for the CA vulva, it is something that women do not want to talk about at all. They don't want. So what happens? Women, if you have itchiness, which is persistent, you have got changes in the skin around your genitalia, and you are advanced in age, postmenopausal. If you see anything that is around there, around the vulva growing, and it does not want to go away, please just come quickly. Let's take a biopsy or let's investigate it. If it is not cancer, praise God. That is great. But if it is, let us catch it still very early. Okay, so we can prevent those two cancers. We also have the another common one is what we call the CA ovary and also the CA endometrium. For the CA endometrium, postmenopausal bleeding, okay, PV discharge, and wasting, lack of appetite. Okay, go to the health center and let us have you screened. Secondly, for the CA ovary unfortunately does not have a screening tool for it. But there are those families, there are those patients that have got relatives, first degree relatives with one CA breast, okay, CA rectum, okay, CA endometrium. If you have first degree relatives with such condition, what do I mean by first degree? Your mom, your sisters. Okay. If you have such in your family, you must be on the lookout for CA ovary because they tend to be familial. They tend to run in families. With such patients, with such a group of people, we can do periodic screening. If you're done with your family or your adipose menopause, we can always remove those ovaries. Okay, so there is no specific screening tool for CA ovary such that we are able to detect it early. Most of the time, we always get them late. Okay, we always get to them late. And if you were to get it early, it could be that maybe you are doing a cesarean section and lo and behold, there is a cyst there or a tumor there. You remove it, you take it for histology, and it confirms for you that it is a malignant ovarian tumor. So that one we can probably catch it early. But most of the time for the CA ovaries, we get them when they are late. But whatever it is, that make sure that you have good health seeking habits. Are we together? I wish I would get a response from each one of you. Okay, so basically that what I can say about gynecological cancers, the two, CA ovary and CA cervix. Those ones you can catch them very early, and the CA endometrium, CA ovary, those ones are a little bit difficult, but we can always get them from the symptoms. The moment you have abnormalities in your body, PVDs get bleeding, please just come running. If the CA ovary, if you have abdominal distension, your abdomen is paining all the time, okay, and it is not going away, even when you take analgesia or painkillers, it doesn't go away, and your body is wasting away, you are getting swollen, please just walk to the health center and let's have you screened and treated.
Thank you. In fact, I'd like to emphasize that point where you were talking about the health workers, once they come into contact with these women, whether they've come in for like malaria or anything else, to catch them at that point and talk to them about reproductive health issues and screening. And that would make a very big difference, because at that time you have them in the health facility and you're able to give them a bit of health education and lay down some preventative strategies at the same time. So we
And
are now,
can,
yes,
can,
yes,
can I
sorry,
just
continue.
can I just add
Yes,
something small?
yes,
You
sure.
see, like I when I was in Yei, uh, when the antenatal mothers come, yeah, there would be always a nurse that would talk to them about danger signs in pregnancy, about high blood pressures, how to the birth plan and all that. You see, so as these women are waiting in the queues, eh, uh, those of us that are working in the hospital, let's dedicate one nurse like this. Eh? Every morning when they are waiting to enter to see the doctor, you can always help educate them. And even when they are men are also part of our health, right? Because they should be responsible over the health of their wives and the children. Okay, so it is easy as we do health education for pregnant mothers. We can very much help educate the community at that level. And the message about cervical cancer prevention can go across the community very fast. And everybody will come for screening. Everybody will take their daughters for immunization. And everybody will get their cancers treated early.
So we look forward to actually starting a campaign like that, where we focus on cervical cancer prevention and screening, and also HPV vaccination for our young daughters, so that they can be prevented from acquiring the infection when they get into an age where they become sexually active. Now, Dr. Kiden, we have come to almost the conclusion of this discussion. I'd like to thank you so much for joining us today and for all the knowledge that you have shared with us. Could you please give us your concluding statement before we end?
All right. It has always been a pleasure to be in this forum. And I'm glad that if you have picked something today, please, the take home message is that, ladies, let us just wake up, right? Let's just wake up and take those daughters for the vaccination. Just as you take that small newborn baby for vaccination against polio and many other diseases that can be vaccinated, that's something, take it as a responsibility for you to take that daughter to go and get a vaccine. Secondly, make sure that you yourself, you are screened. Okay. I don't know, Dr. Idioro was here last time, and I'm very sure she must have mentioned something like this, that we must be screened and we must be vaccinated against the cervical cancer. I don't know how many of us who had logged in during that time have done it. So make sure that you're the custodian of your health. Go, let you be screened, please, and you will have saved your family, your clan, your community, and your country at large, the agony that is brought about cervical cancer. Then lastly, cervical cancer, when it is gotten early, it is treated and it is curative. It is not a death sentence that when you're diagnosed with the cancer, that you are going to die. You can be treated and you can survive. You can prolong your life, and therefore, let us be proactive and let's be there for our families, for ourselves, and for our nation as a whole. Thank you very much.
Thank you so much, Dr. Kiden, for that. As a pediatrician and someone who has infectious disease training, I would like to emphasize on the vaccination part of this discussion. HPV vaccine is it's sort of like a breakthrough vaccine. Imagine a vaccine that can actually prevent cancer from occurring. And it goes both ways. You can vaccinate both your girls and you can also vaccinate your boys so that they're not the ones infecting the girls. So remember, this is a vaccine that can actually prevent quite a number of issues later on in life. And it's a vaccine that can prevent cervical cancer. So please, 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 if you have not done it yet for your young boys and young girls who are not yet sexually active, please take them for the HPV vaccination. And we will be able to win the war against cervical cancer. And as Dr. Kiden has emphasized, and as Dr. Idioro emphasized even before, screening is quite important. Please go for your screening, ladies, and Dr. Kiden and Dr. Idioro, and quite a number of my colleagues who are specialists in the obstetrics and gynecology field are on standby for you to actually reach out to them and ask them your questions and discuss a few of your issues, and they'll be able to direct you where you can get help. So thank you so much, Dr. Kiden, for coming on the South Sudanese Women's Intellectuals Forum again, and for always being available to give your time and your knowledge to discuss some of the issues that affect women in terms of reproductive health care. We are so grateful to always have you on this forum. And I also want to thank the audience for joining us today. Thank you so much for your continued support for the South Sudanese Women Intellectuals Forum. We cannot have impact if we don't have listeners who are able to spread the information that we're able to share on this platform. I'd also like to thank Aisha, who's currently on support on the background. And I'd like to thank the UN Women for their support through the years that we've been in existence in supporting some of these discussions, and all donors who have stood by us until today. And we hope that we will be able to collaborate with many other people who will be able to support the South Sudanese women in spreading and giving out their knowledge and being able to impact on the lives of our people, whether within South Sudan or in the diaspora. So thank you so much again, Dr. Kiding, for joining us today. It was a privilege to have you, and it was a privilege to moderate this session. Thank you so much, and we hope to see you next time. And to the audience, we hope to see you next time during our next live on the South Sudanese Women Intellectuals Forum. Thank you so much, and goodbye.
Bye-bye.
Bye.